We begin this hour with our focus on the conflict in Sudan, where Regional African Trading Bloc has proposed to extend the 72-hour Sudan truce due to expire tonight. The former chief had given initial approval, but the rival paramilitary Rapid Support Forces is yet to respond. This comes as security situation in the capital, Khartoum, is worsening, as both warring sides are accusing each other of robberies and assaults in residential neighborhoods. U.S. Secretary of State Antony Blinken and African Union Commission Chairperson Musa Faki Mahamat have discussed working together to create a sustainable end to the fighting that erupted on the 15th of April. And there is more in this report.
Tens of thousands of people fleeing violence in Sudan are spilling into Chad, with aid agencies warning that larger flows of refugees are expected to arrive. The United Nations have revealed that since fierce fighting broke out in Sudan on April the 15th, an estimated 20,000 people have entered Chad and at least 100,000 are set to arrive, raising concerns about the stability of a fragile region. On top of the number of deaths and injuries caused by the conflict, the World Health Organization expects many more deaths in Sudan due to outbreaks, lack of access of food and water, and disruptions to essential health services, including immunization. The Director General of the World Health Organization, Tedros Ghebreyesus, stated this while speaking in Geneva.
What we have seen over the past 10 days in Sudan is heartbreaking. In a country whose people have already suffered so much in recent years. WHO welcomes the ceasefire agreed between the parties. We urge all parties to fully respect it. Already, the violence has taken a terrible toll on health. On top of the number of deaths and injuries caused by the conflict itself, WHO expects there will be many more deaths due to outbreaks, lack of access to food and water, and disruptions to essential health services, including immunization. WHO estimates that 1/4 of the lives lost so far could have been saved with access to basic hemorrhage control. But paramedics, nurses, and doctors are unable to access injured civilians, and civilians are unable to access services. In the capital, Khartoum, 61% of health facilities are closed, and only 16% are operating as normal.
Meanwhile, thousands of civilians, mostly women and children from Sudan's western Darfur region, are streaming into Chad's eastern provinces amid a growing refugee crisis. UN agencies, along with local partners, have started distributing food and basic items, but as thousands more refugees are expected to make their way into Chad, it's not clear if there will be enough support. Similarly, dozens of Britons have been evacuated from Sudan, with the British authorities establishing an air bridge between Khartoum and Cyprus, where there is a British military base. British Home Secretary Suella Braverman said that Britain had evacuated between 200 and 300 of its citizens from Sudan, adding that an intensive process is running to help the Brits who are stranded there. France has also evacuated more people from Sudan, with the French Foreign Ministry adding that those evacuated included not only French nationals, but also Britons, Americans, Canadians, Ethiopians, Dutch, Italians, and Swedes.